My name is Jenny McKinley and I'm a Professor of Geography in the School of the Natural and Built Environment at Queen's University, Belfast. I'm sure when you think of studying geography, you might imagine that maps play a big role. This is true, but what if I told you that we now have maps that can help us predict rainfall patterns, population movement, and even keep track of infection rates for diseases like the SARS-CoV-2 virus over time. This is what Global Information Science, or GIS, does. Combined with data taken by researchers and others, GIS allows us to create detailed interactive maps that help us to solve difficult problems. Geography has emerged as an interdisciplinary player connecting the worlds of health and public policy with data that is crucial to informing good decisions. For example, geographers using GIS were instrumental in helping shape public health policy in Northern Ireland during the COVID-19 pandemic. You probably remember seeing maps like these during news coverage of the pandemic. These maps often reported numbers of cases, hospital admissions and deaths. But contagion of the virus in the community depends on individual and social behaviour. Such data remain more difficult to record. Geographers were able to use more extensive data sets in combination with GIS to visualise where COVID was likely to spread. One key finding from this COVID-19 research was that people who lived in deprived areas were disproportionately affected by the SARS-CoV-2 virus. Samples of wastewater can also be taken from sites across the country, such as Northern Ireland, and tested for the SARS-CoV-2 RNA. Using wastewater in this way has several advantages. It's non-invasive, it picks up both asymptomatic and symptomatic cases, and gives us information about the prevalence of COVID in an area as large as a city or as small as a building. It also doesn't depend on people being able to access healthcare or testing, so it is a more accurate picture of the disease in the community. At the height of the pandemic, the Public Health Authority used findings from this GIS approach to determine where to place mobile testing units, for example. As the climate continues to change, we will undoubtedly be faced with other crises like the pandemic. The use of these advanced mapping technologies by geographers will become more and more important as we collaborate with policymakers to advise on the best courses of action. Interdisciplinary collaboration has never been more important, and it will continue to be so as we face the challenges ahead.